just joining, you're welcome. Please, let's tap on our screen. More importantly, tap share. That's what is important tonight. Tonight, we're going to be talking about emergency C section. Oh boy. Yeah, in fact, so much information about this. You will learn a lot of things tonight. Alright. So, like I said, it's going to be a continuation from what we were discussing yesterday. Yesterday we talked about labor and we gave all the details. So now let's talk about C-section, right? Thank you for the taps. Thank you for the shares. I see you. Thank you. If you're just joining, you're welcome. You want to learn about C-section, emergency C-section? You're in the right place. So we want to give you information that will kill all fears. You don't need to be afraid, right? So tonight information is going to help a lot of people. By the way, our season is coming to an end. Journey to parenthood is coming to an end. Oh boy, there's been 6 months of tremendous knowledge, 6 months of teaching and learning, 6 months of evidence with things we've learned. Those who are pregnant are already pregnant. Those who have delivered have delivered. God has been faithful and kind. So now I tell you, if that is your case, fertility is your challenge, what are you waiting for? 2024 should not pass you by. No, 2026, sorry. 2026 should not pass you by. And I tell you, by June, remarkable number of people who are trying to conceive would have conceived if they listen and do what we tell them. Infertility is just a question of ignorance. You just need to know what to do. Thank you very much for the heart me. By the way, the season is about to close. In few more episodes, the season will come to a close. And we are grateful and very fulfilled because a lot of people have gotten the results they're looking for, right? Those who have delivered, thank God you've delivered. Those who are pregnant now, those who just conceived, who tested positive, that is the reason why we are here. And we cannot deny that God has been gracious and kind to us. So, like I always say, if you don't want to be pregnant, please don't listen to me. Because if you listen to me hard and long enough, you will be pregnant. I guarantee you that. All right. So now let's go straight into the discussion tonight. So who is ready for tonight's discussion? As usual, please make sure you also engage in the comment section. Right? Engage. Whether you are sending emojis, making comments, just make sure you engage. Right? So who is ready for tonight's discussion? Right? Let's talk about emergency C-section. That is the discussion. And this is a very important topic. Very important topic. Yeah? It's a very important topic. Right, so thank you if you're just joining. Who is sending requests? Hold on with your requests. Hold on with your questions. When we are done with the topic, then we'll go ahead and give you all the opportunity to ask your questions. Is that okay? So you want to exercise some patience. All right, like I was saying, this is a very, very important topic in this journey to parenthood because everyone would hope for smooth labor. That is everybody's hope. That's everybody's wish. That's everybody's expectation. Sometimes surgery is the safest and only option to save lives for some people. So that becomes necessary. Now, if you learned anything we have taught in the past few weeks at all, you'll notice that we've been talking about the normal process. Like yesterday, we talked about labor, right? Talked about labor, the normal processes, right? So today's discussion is to explain and make it clear, right? Not to scare anybody, but to make it clear enough so that people understand that emergency um, cesarean section is not that they failed. It's not a question of failure. It's actually a rescue mission. Yeah, it's a rescue mission. So, if you're ready for tonight's discussion, please type in the comment section ready so that I'll be sure you are still there. If you're ready, just type ready. Right? Who is ready? All right. Ready, 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 ready. Okay. So we're going to be looking at when and why emergency C-section is needed. And it's going to be all about when nature needs urgent medical help. We've talked about the normal. Now let's talk about when nature needs help. When nature needs help. And you see, the reason why this topic is important, you know that many women fear cesarean section. And they have lots of reasons why they are afraid of it. When they hear cesarean section, it has to be village people. It's got to be village people. Right? But again, generally speaking, many women fear cesarean section because they actually have planned for normal delivery. Who wouldn't anyway? Plan for normal delivery. They think surgery, for some people, unfortunately, they think that surgery means that they have failed. You didn't fail. That is what I want to assure you. You didn't fail. Surgery does not mean that you have failed. Some must have heard scary stories of what has happened to A, B, C, D, E, F. And those stories is causing them fear. Amma, good evening, you're welcome. Right? They've heard that how person A went in for CS and she did not come back. Person B went in for CS. It resulted to complications. Person D went in for CS and the baby was like this. So they've heard scary stories. Now they are afraid for themselves. What would my own be like? Would this be me? Would I end up like this? But I will tell you something. Do you know that without cesarean section, millions of mothers and babies would have died every year? Yeah. Without it. So with it, imagine the millions of people that are saved. Remove cesarean section from the equation and see how millions will pass away in the name of trying to deliver. Hold on with your questions. We'll give you opportunity to ask questions after this discussion. Is that okay? Right? So emergency cesarean section exists for one reason. Exists for one reason, and it is to prevent death and permanent damage. I'll say that again. emergency cesarean section exists for one reason. It is to prevent death and permanent damage. Cesarean section is not about comfort. It's not about uh, um, the reason, other reasons other people are giving it. It's all about survival. It's about survival. So, but before we start peeling off the layers, let us first stop in our tracks and help everybody understand what this emergency cesarean session is all about. Emergency C-section, what is it all about? Whether it's emergency S, emergency cesarean, or cesarean, whatever you want to call it, right? Are we ready to go? Are we ready to go? If you're just joining, you're welcome. If you're not following me yet, you want to join in. Those in the FYP, I see you. You want to make sure you drop in and tap on your screen so that other people who needs the information will come along. Is that okay? So let's start from there. What is an emergency cesarean, right? Cesarean section, C-section, CS, whatever it is. But basically, it is a surgery to deliver a baby through the abdomen and the uterus. It is a surgery to deliver a baby through the abdomen and the uterus. An emergency cesarean means it was not planned earlier. That's, of course, the emergency, that's what it means, right? It was not planned earlier. And something unexpected happened during the labor or somewhere around the late pregnancy. Something unexpected had happened, and doctors must act quickly having discover the unexpected eventuality. And sometimes this decision for the emergency C-section, from the time of making the decision to the time of delivery, is somewhere within 30 minutes. Because from the moment the decision is made, it is a race against time. It's a race against time. Because delay can be deadly. Right? But, if you have been here in our climes, I don't know what they do in Europe and America, right? But in our climes, we can delay. Our people can delay. Not necessarily the doctors. Now, this is the problem. Now you discover the problem. Sugar baby, you're welcome. You discover a problem and tell your patient that, hey, this is the problem. We think we should go in for and save the day. The patient will say, let's assume she was even there alone. He say, let me speak to my husband. 15 to 30 minutes has passed. Speak to the husband. The husband will say, let us call our pastor. They call the pastor. 30 to 1 hour has passed. The pastor will do whatever he needs to do, maybe for another 30 to 1 hour. Then they say, let us call our mother in the village. So all this time wasted is taken out of the emergency, which usually is the reason why a lot of people end up with bad news, right? And I told you, from the moment the decision is made for an emergency C-section, it is a race against time. I'm talking about 30 minutes or less. So when are we going to have time to say, okay, let us call spouse. Let us call, of course, you will call spouse, but the calling of religious leaders, grandmother, great grandmother, and everybody in the village. It does not make any sense. So that delay is one of the reasons why some of the damages you see happens. That delay is dangerous. Anyway, having said that, how do doctors decide it's an emergency anyway? How do doctors decide it's an emergency? Doctors do not just rush to surgery for small issues. If they tell you we've got to go in, it means that it's not a small issue. Right? Why? Because the doctor monitors the mother's condition. The doctors are monitoring the baby's heartbeat. The doctors are monitoring the progress of the labor. Right? So if danger sign appears and this danger cannot be corrected quickly, surgery may become the safest option. Surgery may become the safest option. Right? So it's a race against time. But for that decision to be made, these are the things that are being looked at. And what are they? The monitoring of the mother's condition, the monitoring of the baby, the baby's heartbeat, and the progress of the labor. Where danger sign appears, that decision will be made. And from the time of decision making to the time of the eventual delivery, we're talking about 30 minutes. So you don't want to contribute to the delay that will cause the damage that may result. Right? Now, all right, please let's keep on tapping on our screen. Please share the live, it's very important. All right, so up to this point, if you understood anything, even if it's just one thing, talk to me in the comment section. Just type understand. Just type understand. Let me be sure I'm talking to people who are listening. You know, yesterday somebody won recharge card. Is it recharge card? Yeah, data from me from this kind of question. 2,000 naira worth of data from this kind of question. So you don't know what may happen today. So please talk to me in the comment section. I like engagement. Is that okay? So let's go on and look at the major reasons for emergency cesarean. Where were you? Where were you in? It is said that the coming of the Lord will be as a thief in the night. So it can happen anytime. All right. So we want to look at the major reasons for emergency cesarean. I'm going to explain we're going to explain it in details and clearly. And as usual, I'm going to remove all the medical jargons so that you can understand. S and P. I see. You're welcome. Good evening. We'll remove all the medical jargons so that everyone can understand. Yeah? If you're just joining, you're welcome. You've missed a little, but we still have a lot to talk about. Don't forget to tap on your screen, share the live. Not for me, but for people who should come and learn something. All right, so we're looking at the major reasons for emergency cesarean. Right? Who is ready? Who is ready for this gist? Who is ready for this gist? Let's start with the first one. Let's start with the first one. Reason number one. Reason number one. Reason for emergency cesarean section. Reason number one. Reason number one. You want to know the reason or what should be done? You need to see your doctor S&P. Is that okay? Yeah. Of course, there's something like pregnancy induced cases, and it will go away after you deliver. So don't worry. All right. So where was I? So we're talking about reasons, major reasons, not all the reasons, just major reasons for emergency cesarean section. All right. Reason number one: fetal distress. Fetal distress, and that's to say the baby is not coping, right? Now, this is the most common reason worldwide for emergency cesarean section. And what does it even mean? What does it mean? It means that the baby is not getting enough oxygen. It means that the baby is not getting enough oxygen. And what are the signs that the baby is not getting enough oxygen? Abnormal heartbeat on monitor. You know, in the clinic, there are several things they use to check heartbeat, right? Whether they are using their Doppler, they are using their fetoscope, or they are even using ultrasound, right? So, abnormal heartbeat on monitor is one of the signs. When you have baby poo in the water that surrounds it, we call that meconium. That one is not you that will see it, it's your doctor and sonographer. So when you have meconium in the water, you just know this is stress, this is fetal distress. And poor movement. So these three things: abnormal heartbeat, meconium in the water, that's baby poo in the water, and poor movement. These are signs. And what would cause it? What would cause this fetal distress? Who is ready to hear? Who is ready to hear? I want to be sure you're ready to hear. Oh boy. I want to be sure you're ready to hear. If you are just joining, make sure you're following. Oh, my indefatigable car doctor, auto mechanic is here. You're welcome, car doctor. Who is ready to know the causes of fetal distress? Number one, cord compression. Cord compression. When the cord is compressed. Remember, we say fetal distress is when the baby is lacking enough oxygen. And this can be due to cord compression. Cord compression will mean that you are restricting blood flow to and through the baby. And anything that restricts blood flow will restrict oxygen and nutrients. That will amount to distress. There's also the issue of placental problems. There's the issue of placental problems. Then long labor. The labor is long and delayed. Is reason for fetal distress. And of course, infection. Right? So what did I say? Causes of fetal distress, cord compression, placental problem, delayed or long labor, infection. Makeup artist, thank you very much. The reason why surgery is needed in fetal distress is if oxygen remained low, brain damage would occur or death can occur. So I labored for a very long time and my baby died. I'm telling you why. Oxygen is restricted. And that will lead to brain damage or death. So time is critical. The moment these things are observed, I tell you, from the time of making the decision to have an emergency CS to the time that the baby eventually is delivered, you have less than 30 minutes. So it's a race against time. You don't want to sit down there and start deciding. My people, they delay, but God will help us. We will come out of this very soon. Right? It's a race against time. So that is the first major reason for emergency cesarean, fetal distress. Okay, before I go to the next one, now you've seen some. Remember, I said when you have this kind of situation, you can have that is a restriction of blood. When the oxygen supply is low, you can have brain damage or eventual death. For the brain damage, you notice for some children where you see maybe their labor was long, right? You notice that haven't been born, they suffer some cognitive lack of cognitive sense because of brain damage that happened because of what we're talking about, because of fetal distress. So that is the first one. The second major reason for emergency cesarean is labor not progressing. For some reason, the labor just stalled. Pregnancy that was progressing, for some reason, is no longer progressing. What happened? Now, if this happens, it means that the cervix has stopped opening. Cervix that was 2, 3, 4 is no longer opening. What's going on? Lady G is here. It's no longer opening. The baby stops descending. And all this is still despite strong contraction and still despite oxytocin drip that is administered. Boy, what could cause it? What could cause the labor not progressing? Good evening, Lady G. What could cause labor not progressing? Who is ready for this information? Very simple reasons. Number one, the baby may be too big. Big baby. Right? Number two, the pelvis may be too small. Those people that were asking me questions yesterday, this is the information you were asking. I hope you're here. That's why I tell people, don't miss my live stream, because if you miss one day, you miss too much. All right? So I'm talking about reasons why labor will stop progressing, why labor stalls, right? Big baby, large baby, small pelvis, poor baby position. For those who were here when I was talking about baby position, you know what I mean? Poor baby position, either is breached or is lying transverse or presenting wrongly. And also, the uterus may be exhausted, right? The uterus may be exhausted, so pregnancy will no longer, labor will no longer progress, right? And if you continue this labor, the labor has stopped progressing or it stalls, and you as an inexperienced individual, you still want to continue the labor, it may cause uterine rupture, right? Because uterine rupture, because if you are having contraction, it is expected that the cervix will continue to thin out, shorten out, and open. Now, if this is not happening at the level, at the side of the cervix, but yet the uterus keep squeezing this way, keep squeezing, it may cause rupture, uterine rupture. Because is that Christy label? Did I see you? Christy label. You're welcome. It may cause severe infection and baby distress. Right? So for this, the doctor will switch to surgery to save the day. Good evening, Christy Level. You're welcome. Yep. So that is the second reason for emergency cesarean section. The third is abnormal baby position. Of course, you know the normal position, the normal baby position that is expected, the head down, the chin tucked. In other words, it's not like this, right? The head is down, the baby's head just like this, towards the cervix. The chin is tucked and the head is down, presenting with its crown, right? That is what normal position is. Now, dangerous position or abnormal position is when it is lying sideways, or what we call transverse position. If it's lying transverse, more likely it's going to be presenting with its hand. And that is not a proper position, right? Other times you could have even the face. Now remember, I said the chin should be tucked and the head present. But for some reason, the face is presenting, right? And for some people, there is persistent breach during labor. So these positions will block the birth canal, does not give the baby proper alignment to the birth canal. So it blocks the birth canal. It increases the risk of prolapse of the cord. What does that mean? The umbilical cord now will begin to come out before the baby, and that is a problem on its own. So when you go for emergency cesarean section, it prevents the baby from being trapped. Right? If you are still here, please type in the comment section, I'm here. I think it's only Martha that I'm talking to because she's the only one responding. Right? If you're just joining, you're welcome. If you are not following me, you want to follow me now. Tap on your screen, share the live. and make sure you learn something. And if you have not dropped a heart me, what are you waiting for? Drop a heart me, right? Drop a heart me. Join the fan club. Appreciate what we are doing. All right. So we're still talking about major reasons for emergency C-section, cesarean section. Number fourth reason, where you have, I mentioned it earlier, umbilical cord prolapse. And this is very serious, where what happens is that the cord slips out before the baby. The cord slips out before the baby. And what happens therefore is that the baby's head presses against the cord, which will compromise the supply of oxygen. It cuts off the supply of oxygen. Hello from Monrovia. You are welcome. Welcome in. Good to see you. Right? So if that happens, if the cord prolapses and the baby's head is pressing against the cord, it cuts off oxygen supply. And this is a real emergency. Right? In fact, the baby must be delivered immediately for obvious reasons. Remember, if oxygen supply is compromised, there is a risk of brain damage or fetal death. So you got to make up your mind. And I told you, from the time of making the decision for the emergency CS to the eventual delivery of the baby, you have 30 minutes. Even though God is helping us, our people, we can waste time. You say, oh, CS, okay, let me call my pastor. Maybe miracle can happen. The pastor will come and pray for 2 hours. Taking more than enough of the 30 minutes emergency. The pastor finished praying. We now call on village people. So we are going in for, oh boy, you people are just wasting time. They're just wasting time. Right? So if cord prolapse happens, the baby must be delivered immediately. Right? And do not be in that place where you, because when it happens and these babies are, maybe let's say for example now they are eventually delivered and you are now noticing that the child is not behaving normally, you start blaming devil or witches. Come on, man, you already know. That's what I'm telling you. That's why I'm making it known. You want to blame yourself actually, because it was your lack of decision that got us here. You're going to be sorry for your lifetime. You don't want to find yourself in that position. Is that okay? So be smart. Be knowledgeable. I told you, nothing is difficult. The only reason why some things look difficult is because of ignorance. And we are curing the ignorance here. Number 5 reason, we're discussing major reasons for emergency C-section. Right? So number 5 reason is placenta abruption. Placenta abruption. Don't worry about the big name, just understand the concept. Number 5 reason for emergency CS is placenta abruption. Placenta abruption means where the placenta separates from the uterus too early. Baby is still in the womb. Placenta is separating from. Mr. Tabs is here. Welcome in, Mr. Tabs. Good to see you. The baby is still in the womb. Still requires oxygen and nutrients, even though we are close to delivery. But now the placenta is separated from the uterus. That is an emergency. What will cause this? Not what will cause it. This, when that happens, basically what you begin to see, you see severe bleeding. And remember that we need that connection for the baby to continuously have nutrients and oxygen. So when that separation happens, the supply of oxygen is lost to the baby. That is an emergency. So both mother and baby are at risk. Both mother and baby are at risk. Emergency surgery will save both the mother and the baby. So they are not advising you for emergency C-section because they are going to make more money. No, that is not the reason. That is not the reason. It's to save both the mother and the baby. Right? So that is the number 5 reason for emergency C-section. If you are just joining, we are talking about the major reasons for emergency C-section. And of course, we've discussed what C-section is before you came in. So if you're just joining, you're welcome. All right. All right. So the next reason, that will be number 6 reason, is uterine rupture. It may be rare, but it's deadly. The very house that contains the baby is tearing apart while the baby is still in there. That's deadly. And this will occur when the uterus, you have the cervix still holding on tight. Now, if you have been here for the past 2 weeks, you already know what I mean when I talk about cervix. Cervix holding on tight, and there is strong contraction. Right? So it will lead to the uterus tearing open. And often it will happen in women with previous C-section scar. Right? So you see why you are so special. Now, what are the signs for you to know? The signs for you to know that this uterine rupture. You don't get network, Mr. Tabs. Sorry. Network has happened to you. Sorry about that. But it's okay. Thank you. Thank you for joining. Thank you for joining. Right? So the signs of sudden uterine rupture. There is a sudden severe pain. Sudden severe pain. You see, I've seen these things a number of times, and I usually don't want to remember them because it's not palatable. Right? Okay, just for your knowledge. Oh, Pretty Gold is here. Thank you, Mr. Tabs. Yeah? So, sudden severe pain, loss of contraction. The contraction that you used to, we've talked about contraction before, so I'm not going into those details. The contraction that used to come in regular interval, for some reason is lost. Right? where the baby is distressed and there is internal bleeding. Good evening, pretty gold. You are welcome. In this case of uterine rupture, or we want to say womb tearing up, in this case, only emergency surgery can save the mother and the baby. Only emergency surgery. There is no way, nothing, no other way to bypass it. You've got to go in for emergency surgery. Right? Right. So as I'm mentioning, I'm just remembering some of those cases, and it's not so palatable. Right? So the next, if you're just joining, we're talking about the major reasons for C-section, emergency C-section. Right? The major reasons. The next one, which is the number 7th one, is, thank you very much, is severe maternal complication. Now, where the mother has some complication. Thank you, unisex. Right? It's not only the baby that portends danger. It's not only the baby. Sometimes the danger is from the mother. Right? And examples of such complications, example is severe preeclampsia, eclampsia, aka seizures, heavy bleeding, infection, heart troubles with the mother. And if you continue labor, if you would continue labor, you may just kill the mother. Right? Such complications, you just go straight and deliver the baby through emergency C-section. Urgently. Oh, I remember a situation. Not relating to any of these, but I want to tell that story to advise women, mothers. Years ago there was a situation that happened. A certain woman whom I saw all through. I usually remember all the cases because from when they conceive to when they deliver, I'm always participating. Right? So this particular case, which I will never forget in the life, we followed her through. She came for antenatal care all through. Or even when she was in labor, I was actually there all through the night. Yeah, I could remember clearly. But that was not my case. Somebody else was in charge, right? But I was there for something else. I was around for something else, right? So the pregnancy, the labor was progressing just okay. Everything was moving just all right. Then I think it was somewhere around 4 to 5 in the morning, early morning, and the woman lost breath. She couldn't breathe. The last thing we heard, just within 1 minute, pregnancy was progressing. Nothing really was wrong. So the only thing we could hear was, "Doctor, I can't breathe. Doctor, I can't breathe. Doctor, I can't breathe." And she breathed at last. What happened? That was the most confusing case ever. What happened? Good evening, thrift vendor. I see you. What happened? It was so confusing. Mother and child was lost. So anyway, we got to know after interrogating the husband, because we needed to talk with him, right? We got to know that the woman was asthmatic, but she did not report it all through her time of antenatal care. She didn't mention that to the to the to the to the doctors that she met. Nothing in her record shows that her history of asthma, and that was how that case. I will never forget. So if you are going for your antenatal care, even if it was cockroach that scratched you while you were sleeping, please make sure you tell your doctor. Tell everything there is. So it was the husband that told us that she was asthmatic. They said, "Oh, that breathlessness was was actually a crisis." But how would the doctor know? He's not a magician. There's nothing in this in the history that says anything. Anyway, so it's very pathetic case. I like telling story to use it to advise women. Please don't hold information when you get to your doctor. I love one very wonderful patient of mine. She said, "Let me not lie. Let me not lie." Then she'll tell you all her life story. Oh boy, I love these people. Big Bobby, you're welcome. Right? So, good evening, Big Bobby, you're welcome. So, if you are just joining, we're talking about major reasons for emergency C-section, right? And we just talked about severe maternal complication, and I've given us 7 major reasons for that, right? Oh boy, let's continue. Let's continue. Let's continue. Now, just to give us an insight, a quick, how do they call it now? Sneak peek on what Barbie, can you exercise patience? No, 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 you just enter. You didn't learn anything. You want to ask question. What do you want to ask? Eh? Why your blood dey rush? Why are you like this? Right? So let's let's have a sneak peek. What happens during emergency cesarean? Just a quick peek, sneak peek on what's happening. Remember, it is urgent. It means that things must move pretty fast, right? Things must move pretty fast. So I'm going to give you step by step, fast, 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 the same way it will be done when it is done, right? So the first step, the decision. First step is decision, and this is where my problem is with our people, because they will not take the decision early. Some will tell you, "I reject it, I cancel it, not in my family, not it, I will deliver as a Hebrew woman." These people are just, I don't know. We've got to make the decision. And here you are casting and binding the demon out of your doctor. Then after they are through with the doctor, they will now call the clergyman to come and do his own. Then call people in the village to come and do their own. Wasting too much time. But basically what the doctor do, they will give you, the doctor will explain briefly why the surgery is needed. It's not long story. briefly. It's only here in this live stream that I'm going to give you a 1 hour reason, right? Which I'm doing today, right? But in real time, just briefly, why is needed, right? Then they will get your consent. Are we ready to go? Are we good to go? It's not time for discussion. Are we ready to go? So when we are done with that part of making the decision and the green light is gotten, the second step is preparation. Yeah, the mother is taken to the operating room, given anesthesia. Anesthesia usually will be spinal or epidural if possible. Then, if the baby is in immediate danger, general anesthesia may be considered, right? So that is the second step, the preparation, and that is preparation. Then step 3 is the surgery proper, right? Where the incision is made through the skin and all that. The baby is delivered within 5 to 10 minutes after incision. From the time that knife goes like this to when the baby comes out, it's about 5 to 10 minutes. After that incision, the placenta is removed, the uterus is stitched, the skin is closed. Yeah, 5 to 10. Why? Because the 5 to 10 is within the 30 minutes from decision making to delivery. From when the decision is made to when the baby is delivered, 30 or less minutes, right? So that moves to the next step, the assessment of the baby, where the pediatric team or the pediatrician will take over from there, right? They will be checking if oxygen is needed, if NICU admission is necessary. So they'll do that assessment. That is step 4, right? And that brings you that completes the whole process within the 30 minutes. Now, this whole cesarean section thing, the emergency CS and all the thing that needed to be done and considered, right? It has emotional impact on the mother, actually. Those who have gone through it will testify. Some women feel shocked, right? Some women feel shocked. Some feel disappointed. Some feel guilty. Some feel trauma, especially if they had expected natural birth. But the important truth is that a surviving mother and a living baby is the real success of childbirth. So anyhow you want to feel it, it's not a cost to have a cesarean section. Because what is more important is the surviving mother and the living baby. Have you not seen people who go in the name of delivery and they came back alone, no baby, because something went wrong? Or some others who went and never came back. So what is more important? So the feel of guilt, the feel of trauma and disappointment, that is unnecessary. The surviving mother and the living baby is more important. In fact, it is the success of the childbirth. Right? So, but again, such people would need psychological support after the emergency C-section, and it's very important. That's why I keep on hammering on supportive partner, supportive partner, supportive partner. Besides the supportive partner, just have what do they call it now? Just have support, basically, right? So remember, I told us that millions. In fact, it's important to know. It's important to know about 20 to 30% of births are actually by cesarean section, right? And half of that are emergency surgeries. Half of that number, yeah. I don't want to mention the limitations in developing countries. Let's not talk about that because we'll be so disappointed. But the World Health Organization has stated that cesarean section save lives when it is medically needed, right? When it is medically needed. But this unnecessary cesarean section should be avoided. It should be avoided. Yeah? If you're just joining, you're welcome. Please, let's tap on our screen, share the live. You're welcome. Thank you for the likes so far. So if you are still here, just tap I'm here so that I will know you are there. And those who have questions, let's begin to prepare our questions because I'm getting ready to take questions, right? There's still more to talk about, but I don't tire. There's still more to talk about, but I've run out of energy, so we may just take questions, right? So that's what the World Health Organization said. Now, when you compare planned surgery versus emergency C-section, the C-section has a higher risk for the mother. Mudoti, it's very simple now. The answer to your question is just listen to me. Don't miss the next season. Don't just listen to me. You'll get the result. Right? So emergency has a higher risk for the mother. Like there's more bleeding, infection, risk of infection, longer recovery, and emotional distress. Right? The risk with respect to the baby may be breathing problems, right? And NICU admissions. But these risks are still far lower than for you not to operate when it's needed. If you don't operate when it's needed, be sure you are putting your life and your baby's life at risk. One or both may not come back. So you want to be smart. You want to be smart. All right, that's where I want to end today. That's not all anyway. That's not all anyway, but I just want to answer some questions. If you have questions, you want to send in your requests. You want to send in your requests, 30 minutes. We'll dedicate 30 minutes to answering questions. So send in your requests, please come up. Let's talk. Let's talk. By the way, long story short, there is nothing wrong with cesarean section, right? Forget about all those traditional belief of it. It's not failure. It's not failure. It's actually a medical intervention that saves lives. Is that okay? Thrift vendor.
Good
You're
evening.
welcome.
Good evening, sir.
Good evening.
Awesome.
You're welcome. Talk to me.
Okay, my question goes like this though. Um, Currently 39 weeks.
Mm-hmm.
So when the last I checked my scan at 37, I was told
Mm-hmm.
the weight is 3.5. Okay. So although my first child was 4, it was 4 kg. So doctor was insisting that maybe I should do an induction. Well,
Mm-hmm.
I'm actually scared of induction because of the stories I've been hearing about the pains. Because
Mm-hmm.
doctor told me that the more the baby stays, the more it gets to add weight rapidly.
Hmm. So just backtrack a little, right? The last scan you did, which was when exactly?
37 weeks, 2 weeks ago.
37 weeks. Okay. And you said is how many kg?
3 points, I think 3.4 or 3.5. I can't.
Okay, so what's the problem? 3.4,
Mm,
37 weeks. You are
yes.
good now. What you happen?
So doctor was insisting that maybe I should opt for an induction because said the more the baby is staying, the more the baby might be intending to add more weight.
That's true.
So
But does
although
not necessarily mean that. Or are you eager? Are you so eager to see the baby today?
no, I'm not so eager. But the issue I'm always having is that I've been feeling this pelvics, this heaviness of pelvics, mostly at night when I sleep. If I want to turn.
Are you are you seeing me for the first time? Are you just coming for the first time?
No, I'm not just coming now. I've been joining, but I don't used to
So
stay for long.
Were you not here when I was discussing about labor?
Yesterday. I couldn't stay
I
for long.
discussed labor
Was it
yesterday.
yesterday? I'll be 2 days ago.
I discussed labor yesterday. In fact, throughout this week, I've been discussing everything that has to do with labor.
I've not really been constant.
That's the problem now. Otherwise, what you are asking now, you will not even ask it. You already know, right? So, how else do you expect labor to start? Right? It has to start from somewhere. Isn't that so? Oh, you're expecting that it will just catch you unawares. Are you there?
I'm here with you.
Good. So calm down. Pressure, lower abdominal pressure, cramps, back pain, all those things. These are all of them will culminate, continue to increase until you finally push that baby. Is that okay?
Okay.
And by the way, 37 weeks, your bags should be ready.
My work's already. I'm 39 presently.
Oh, 39, and you're still talking to me.
Presently.
Wait, may bond became by tomorrow, right? So have you seen show?
No.
Not yet. Okay. I hope you are moving around. You are taking walks.
Yes.
Better do. You don't want to stay. You don't want to stay for too long. So make sure you do play your part. Then allow the doctor to do his part. Is that okay?
Okay.
But as it stands, I don't see any. You don't have any. I'm not hearing any problem anyway. Is that okay?
Like
So
every
by
morning, maybe I climb the staircase, like up and down, like
how many
anytime.
flights of staircase?
Just 2 flights. So I go like up, I'll come down like 5 times up and down in the morning
Nice.
and in the evening.
All right. You are doing well. Keep at it. Is that
Okay.
okay?
All right. Thank you.
You're welcome. Um, Uno Christine. Uno Christine is trying to blackmail me. He said I've not been answering her. So what was your question that I did not answer for the past 1 week? Oh no, Christian. Ask the question again. So I think I saw a question from from I don't know how to pronounce your name. Inyama. 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 The answer to your question is no. Right? An elective CS is not automatically uh, um, necessary because you have reached for the 3 weeks. No, no. So that's the answer to your question. Big Bobby says, as a lady who has fibroid and also pregnant, the CS is the best. But what's the size of the fibroid now? Fibroid, when you are dealing with fibroid, is about location and size. So that's what you should be looking at, right? So you want to give more light to that your question, Big Bobby, right? Location and size. Depend on the location, you can deliver normally. But if the fibroid is is complicating issues, then you need CS. I was asking why was I do CS after a previous. Are you pregnant? We're not sure. If you are pregnant, how many weeks are you? So these are the kind of information we need to get to be able to answer you adequately. Is that okay? If you are pregnant, how many weeks are you? And what are the other issues? Are there complications? There are things that your doctor will see that would make him advise you for CS. So part of which you should be listening to him. Yes, 38 by tomorrow. I'll schedule. Go ahead. Go ahead. Right? Oh no, go ahead. Your baby is. I'm not sure. I'm not sure that word. Do you want to write it again? We need to understand that your baby, that your friend's case, Barbie, big Barbie. We need to understand your friend's case. If she has fibroid and the fibroid is complicating her her issues, let her have her CS and rest. And I'm sure the doctor has even advised her, and she's the one that is refusing. Right? Okay. You may want to send a request and speak with your mouth so that I can understand you, Unu Christine, right? Because I'm not understanding you. You are 43 years old, not 40. So please rephrase your question so that I can be sure what you're asking. Is that okay? If you're just joining, you're welcome. If you have not followed me, please follow me now.
Good evening.
Hello. Good evening.
I was saying interval. I don't know if I'm spelling it well or
Leave the
saying it well.
interval. Go back to the whole gist again. Let me understand you.
Okay. I had my first child around 20 uh, 2024 February
Okay.
February, and I had complications then because I missed my due date. So I was induced into
Mm-hmm.
labor, but unfortunately, my labor lasted for almost 4 days. It was not what word will I use now? I was not
It was not progressing.
dilating. I was not dilating fast. I was still in like four cm. I don't forget how they used to say it. But I was sure not dilating, and the pain was too
Are you
much.
joining us for the first time?
For the first time, not really. The time I used to come, you'll be talking about another thing. So I'll just go. You will not be talking about my own
Oh, so you will
how will I put
go.
it now?
You are not serious.
No, sometimes you'll be talking about maybe first trimester. It's not too long ago that I joined Sha. It's of recent when you started entering third trimester, I started coming in. But you will not be saying anything concerning my case. And again, I just don't have enough data. So that's why.
Say you don't have enough data. Don't tell me that I'm talking about on the right. This woman.
Sorry.
All
So
right.
to cut long story
Long
short,
story
they had
short,
to
yeah.
do an emergency CS for me. Yes, they had to do an emergency CS for me. So now I am currently 38 by tomorrow. I was supposed to be
Okay.
scheduled last Saturday, but my doctor said no, I should wait till I'm at least 38,
Mm-hmm.
38 weeks
Yeah.
to do it. And he's saying he's scared. Let him know because he doesn't know if my scar is properly healed, and because of an operation they did on a lady not too long ago that her womb got torn or something like that. I forgot. I mean, I don't understand all those English terms doctor use, but he said it would be risky if I tried, especially if my cervix refused to open the first time. He doesn't know if this one will open again.
Okay.
And if I decide to
Obviously,
wait, and if I decide to wait, he doesn't think he would allow me to do another induction during this second pregnancy.
okay. This is your question. We answered it in today's discussion. Were you listening, or your network threw you out of
I
the?
just came. I just
That's
came
the
and I
problem now.
bumped
You are
into
not
it.
always available. You are not always available. So much so that even when we're talking about you, you were not there. Right? So
Sorry.
I used to tell people, if you miss one of my live stream, you have missed too much. Even the one you thought is not
Uh,
important, it's not important to you. Now the one is important to you, you missed it. Right? So I think there are
anyway,
many
I'm
things
just very
about
nervous. That's why.
your history I don't know, but I will tell you something. You want to
Yes.
you want to throw away the fear. There's no need for fear. In fact, it's to your advantage if you have your CS done as as soon as tomorrow, right? So there's no need to be afraid,
Yes.
right? So if
Okay.
for any reason the cesarean section is indicated, go straight, make the decision, and continue on to carry your baby instead of putting yourself in a situation where there will be more complications, right? Remember that we
Okay.
said,
That's why he was telling me because me, I was thinking that I should just wait. Maybe I should just wait a little longer so labor will start. But him is saying that if I wait, he doesn't that he doesn't want. I don't know. It was just scaring me. It was just saying that one is going to be on my head if I decide to wait. That it won't force me to do this. Yes.
okay, the other details I don't have, but I think if it is indicated for CS, you can have your baby once and for all. Is that okay?
Okay. Yes,
Mm-hmm.
sir.
And kill fear. Tell fear to leave you alone. Is that okay?
I'll do just that. I'll do just that.
You don't need to be
Yes.
afraid. Don't worry. It's not. That's why I give all the details today and all the steps today, so that you have an idea what they are advising you, what they are doing for you, right? So calm down.
Okay.
Um,
Hope you can recap a little since I didn't hear the other
eh?
ones.
Don't try. You give me one line to recap.
Anyway, on the with how many followers do I even have? God. I'm even surprised that my request came up.
Now, of course, you can. It doesn't matter your followers now. You can always come up on the box.
Okay. Okay.
So after saying all this, by Sunday, anyway, I don't go on live stream on weekends. So by Monday, I should be hearing that you have your baby with you and you are at home.
Amen. Oh, yeah. Amen.
So
I
by
wish
Monday,
that
I'm looking forward.
more than
There
anything.
are two people. I think I've not seen them on the live stream this week. Maybe they have delivered. So I know that it's usually stressful when people deliver. So by Monday, make sure you deliver, and we are ready
Amen.
to celebrate you.
Okay. Thank you, sir. Thank you, sir.
You're welcome.
Okay. But how
Talk
did
to
they
you.
turn off this thing, sir?
Don't worry, I'll take you. I'll take you now.
Okay, thank you, sir. Bye. Good night.
Mm. Inyama, back to your case. You said you are 43. Is there any complication? What's the size of your baby? So these are the information you need to give to us, right? So 43 years old. How many weeks are you, right? How many weeks are you, Inyama? So that's the information I need. Please give complete information so that we'll know how to answer you. No, didn't they tell you, Big Barbie? They didn't tell you the things you will feel due to the anesthesia. They didn't tell you. These are kind of information you should have gotten. But don't worry, it will relieve you. Don't worry, right? But if you feel so much of a pain, see your doctor, please. Yes, so all those people that are that are having naming ceremony coming up, remember our amala and ewedu soup, because that is what we are eating, right? All the naming ceremony that is coming, especially for those that conceived last year, our amala and ewedu soup should be kept aside, special. Then those of you that are conceiving this year, we will see what we eat. Maybe we'll see what we eat. Maybe it's something special from Gambia. I think so. So Big Bobby, don't worry. After some time, it will wear off. It will relieve you, right? So calm down, calm down. At least you have your bundle of joy now. After a while, you'll be fine. Is that okay? Yes. So next week, item 7 go many. So we are going to enjoy. we are going to enjoy. All right. If you are just joining, please, you need to follow me. If you are not following me, ask your questions. Ask your questions now. All right. Ask your questions now that you can. Otherwise. Big Bobby, just give you time. Don't worry. Okay, you should go to your doctor actually instead of just staying at home and minding the pain. Go to your doctor, right? So, guys, during the weekend, I don't live stream Monday to Fridays, 7 p.m. Nigerian time, and more likely we are rounding off this season by the end of next week. Hopefully, we will. And when that ends, that automatically ushers us into the next season, which will begin as soon as, especially for people that are trying to conceive. So you know somebody who has infertility challenge, trying to conceive for a very long time or for 1 year and above. You want to get them to come. Let's advise them. Let's give them information that would save them time, energy, and money, because that's what we know how to do best, right? And if you don't want to get pregnant, you can also use the same information and try not to get pregnant. But I guarantee you, if you listen to me long and hard enough, you will get pregnant. All right, so guys, ask your question. If you don't have a question, we will shut down the live stream in few minutes. Less than 10 minutes, we will. Right? So you want to take time, put your questions together and ask it. Uche is a good yeah, it's a good question you ask. The reason why it is usually suggested is the the age comes with lesser strength, muscular strength, right? So the contractions may not be strong like when you are younger, all right? Especially if you have not given birth before. So if your doctor is indicating it, please follow them, right? You may not be having stronger contractions that will help your labor. Is that okay? So it's not out of place. Lulu Josh, you need to see your doctor. I don't know why. I want to know why you're asking the question. Why are you asking that question, Lulu Josh? Hmm? Why are you asking that question? Hoster, thank you very much. If you have a question, please come up and ask the question. But Lulu Josh, speak with your doctor. Is that okay? Because when some things are administered to you, is a function of your medical history. It's not just out of the blues. So yeah, so you want to speak with your doctor about that, right? Because they don't just prescribe for prescribing sake.
I know they carry stethoscope, but I they see hope with every scope. Heart beat like drum from the most high. Small belly joy, no be small guy. She look my eye, she won't believe. I show am lightweight, make her relieve. Love they grow for where fear they hide. One scan, joy bust open wide. I scan for love,
Polanle, I see you.
I they watch joy bust through the
All
screen.
right, in a few minutes we are gone.
Some they pray, but
If you have not followed me, you want to follow me now.
for love, no life amount.
Thank you guys for the taps. Thank you, Idara. Thank you, Unisex. Lady G. Thank you very much. Pretty Gold. I appreciate you. Bloom Beauty. Thank you. Mashenge. Mashenge, what country are you from? Mashenge. Mashenge Umkize. What country? Gifty. I see you. Thank you very much. Thrift vendor. Thank you very much. Mashenge, are you still here or you are gone? Lulu, what country are you streaming from?
I show them the heartbeat, tiny and strong. A rhythm of love where miracles belong. Wiggles on the screen, they smile and cry. A first hello before the lullaby. She finds out it's a girl, been waiting so long. He sees his son, says I gotta be strong. Sometimes it ain't the dream they plan, but they hold on tight, love close at hand. It's a joy and a storm, it's hope and it's pain. Tears in the sunshine, love in the rain. Every scan's a story, old souls and new. I'm just the witness in the heartbeat blues. Some news breaks hearts like glass on stone. I see the fear, but I stand alone. I hold their silence, I bear their tears, praying they find peace through the years. Some come back smiling, some never do. Some I can't forget, some I pray for too. They say I help, but they help me see this work's a blessing wrapped in mystery. It's a joy and a storm, it's hope and it's pain. Tears in the sunshine, love in the rain. Every scan's a story, old souls and new. I'm just the witness in the heartbeat. saw heaven, today I saw loss. Some dreams took flight, some dreams got crossed. Still I thank the stars, and I stand true to the silent songs of the heartbeat. The heartbeat blues.
All right, thank you guys. See you guys on Monday next week for the concluding episodes of Journey to Parenthood. Thank you for the taps, for the likes, for the shares, and the comments. Make sure you have a wonderful night rest and a great weekend also. God bless.